Good evening, ladies and gentlemen, to tonight's Health and Adult Social Care Overview and Scrutiny Committee special meeting. Can I go to item 1 first, please? That's the election of Vice-Chairperson. As you know, Councillor Luella Prenter has recently joined the Cabinet. Therefore, she is not allowed to serve on Overview and Scrutiny anymore. Therefore, can I please have any nominations of Vice-Chairperson for the rest of the municipal year? Councillor Prenter? Thank you very much. Is that supported? Supported. Is that agreed? Agreed? Thank you very much. We look forward to seeing her at the next meeting. Apologies for absence. Wayne?
Thank you, Chairperson. We have apologies for absence from Councillor Hine and Councillor Campbell. Councillor Brown is here for Councillor Campbell, and I understand Councillor Spring is due to attend for Councillor Hine.
Thank you very much, Wayne. Can I sign the minutes of the meeting of the 18th of June as accurate, please? Is that agreed? Agreed, thank you. I have no urgent business to announce. Are there any disclosable pecuniary interests or other significant interests or any declarations of whipping this evening at all? No? Great, thank you. Okay, so we're going on to the main item for this evening's meeting. That's the ICB update on transformation of community services. Just for all the guests, if you can just introduce yourself, that'd be great first of all, if we just go along and just introduce all the people that I've asked to attend this evening. And then we're going to go to Paul, you first, obviously, to present and highlight your report. But I will call members in at the specific time in order to ask questions if needed. Okay? So can we just go from the end down? Is that okay?
Good evening, I'm Paul Bentley, Chief Executive of NHS Kent and Medway.
Councillor Theresa Murray, I'm the Deputy Leader of the Council and the Portfolio Holder for Health and Adult Services.
Good evening, everybody. I'm Councillor Mark Joy. I'm the Opposition Spokesperson for Children's Services and Education.
Thank you very much. Can I just remind everyone just to pull the microphone near you when you talk? That'd be really helpful for members. Obviously, we invited representatives from the CYP Overview and Scrutiny here this evening. Unfortunately, the Chairperson, Councillor Howcroft Scott, is away at the moment, and Councillor Mrs Turpin is also unable to attend the meeting. The Vice-Chairperson, Councillor Mandarakis, has recently joined our committee, and we are joined by Councillor Joy, who is the Opposition Spokesperson for CYP. So just in case you're wondering why we've got Councillor Joy sitting with you, Paul. Okay, over to you, please, Paul.
Thank you, Chair, and thank you to committee members. The page numbers that I'll reference in what I'm about to say are the ones at the bottom right-hand corner from the master pack. So if I can draw the committee's attention to page number 19, which is entitled Health and Adult Social Care. The reason I want to do that is that in the paragraph 1, there are 2 recommendations for the committee to consider this evening, and I think it would be most helpful to consider them separately. So I was going to take the issues that are identified under 1.1a and take you through the paper and the presentation that I have, and then separately to move to item 1.1b, if that is helpful to the committee to separate it into those parts. If I may then, Chair, turn to page number 25 at the bottom right-hand corner, which is the paper that I presented in advance of this meeting and that was circulated to the committee. I would ask that the committee take that as read, but I do want to highlight a small number of things because I think they're particularly salient to the areas that you want to apply the scrutiny to. So I'd like to start on behalf of the ICB and just to reconfirm I'm the accounting officer of the ICB, language that will be very familiar to colleagues around the table. And I want to start by absolutely and unreservedly apologising to this committee because the determination about adding children's physical health services, and that's an important distinction, should have come before this committee before now, and it didn't, and that is my responsibility, and I unreservedly apologise that that was the case. I am nonetheless grateful for having the opportunity to come before you this evening, and thank you very much. The second point that I think is really important to explain and to explore, and I'm still on page 25, is that the way that this decision was arrived at. So we have a very successful, and it's been identified as such, joint commissioning arrangements between NHS Kent and Medway Medway Council for children's services. And the previous evidence that this committee has heard was minded to procure adult community health services, but not children's. These are, just for absolute clarity, these are district nurses, physical health services, the sorts of services that primarily go into people's homes and look after them, hopefully keeping them out of hospital. But what was apparent was that when that decision was shared with the committee, we were still in a situation where we had to make a determination about children's services. And what I would say in terms of the children's services is that the decision to go to market and create a lot, in the technical terms, which is a grouping of services for Medway and Swale, was a joint decision. It was a joint decision between NHS Kent and Medway and the officers of the council. And I welcome that. I think that's a good thing to do. That is absolutely what co-design and co-working is all about. So if I could just take the committee into that in a bit more detail and invite committee members to turn to page number 26, which is at the, and draw attention to the top of page 26, which is, and I know you've heard some of this evidence before, but I think it's important, that contracts for community health services have grown organically. They have not been out to market for nearly 10 years now, and they are provided to the citizens of Medway by a number of organisations, different organisations, health organisations. And one of the reasons, and I know you've heard this evidence before, was that we want to have the very best quality services for children and their families in Medway. And we believe that the way to do that is to test the market and to see what the market could deliver in terms of high quality, outstanding healthcare for children and younger people. But what I would also highlight, and I'm now turned to page 28, so over the side, is the real need and the real desire on the part of this joint arrangement to listen to the views of the people that we serve. Committee members are aware that we serve just over 2 million people in Kent and Medway, and I did just want to draw to the committee's attention about halfway down on page number 28, is the things that we have done to reach the widest possible audience and make sure that we can get the widest set of views. So the 1.1 million, so just over half the people that we serve with messaging, people have signed up and participated in a number of events. We've spoken to the 14 community organisations, 1,500 postcards, 4 community events, 135 adult surveys, 38 children's, staff surveys and staff interviews. And by dint of coincidence, today is significant because today what we have done is we've launched the process, which is set out by statute in terms of how we arrive at the right conclusion for the people that we serve. I would just draw to colleagues' attention, and I'm now at the bottom of page number 29, that the discussions that took place were shared discussions. I can absolutely provide for assurance, I'm at the bottom paragraph of page number 29, that there is no plan from the ICB to change those services as we go to market. I know that's a point that's been made to the committee before, but I think it's important to make that point. And then to highlight, over on page number 30 and continuing on to page number 31, the work that has taken place and the sequence of communication, meetings, determinations, right up to and including July the 9th, so just over a month ago, where this issue was discussed and shared, and rightly, with colleagues from Medway Council. And then my conclusion, so I'm now at the bottom of page number 31, where the decision to do this has been a joint decision, but I absolutely end where I began, which is I unreservedly apologise that that was not brought in front of this group and this committee, and that was a failure on my part and our part.
Thank you, Paul. I think it would only be fair to ask our Director, Leanne, to just come in, because obviously the confusion around the joint decision, I feel we just need to, obviously it's not labouring the point this evening, because the purpose of this evening is to get into the crux of whether this is a substantial variation. But I think it's only fair if we did ask Leanne with regards to it being a joint decision and when people knew. Leanne?
There certainly is joint commissioning arrangements between the ICB and Medway, and they work very well. I think the recent SEND inspection was testament to that. Inspectors came in and liked what they saw around joint partnership commissioning arrangements. Of course, you know, what's set out here, I have no reason to believe that is not the case. However, there are certain points that have been made that I think I need to highlight just so people understand the process. So on page 30, the last paragraph, it talks there about me personally chairing a meeting. That's absolutely true. I'm a member of the Kent and Medway Children and Young People's Programme Board. It's made up of KCC, Medway and NHS Kent and Medway. It's a formal board of the ICB and it's strategic in nature. And the board will enable and support the agreed subgroups to drive the delivery of strategic aims. So that's a very good example of how joint commissioning works. The chair rotates, so I could be chairing any of those meetings. It's not particular. I don't choose which one I chair. So it would be wrong to infer that because I chair a meeting, I'm necessarily in agreement, because there were no specifics at the meeting I chaired. The minutes are generic in nature. Nevertheless, we are working to joint strategic aims. That is our business. It is our day-to-day business. But there was no mention from the ICB about the obligation to return to HASC at that meeting. So I acknowledge the Chief Executive of NHS Kent and Medway's apology, but I do think there are some broader things happening here. But we must be positive, or I must be positive. What comes to HASC seems to be an issue around the joint commissioning. I'm not sure there's a common arrangement or understanding. So, Chair, through you, I would like to offer training on HASC and the need for scrutiny. I've asked my Democratic colleagues to help me with that, so I would be only too pleased if ICB colleagues could join us, because I want to absolutely nail down what needs to come to this committee. We cannot have this ever happen again. And it has happened in the past, and I'm not going to go there because I don't want to raise issues like that again. We must be positive, and that is a positive thing that I can do. So I'm also wanting to look at joint partnership commissioning arrangements to make sure that they're fit for purpose, because currently, as I've said, they work well, but I'm not sure they are still fit for purpose for Medway Council and the ICB, because those arrangements were taken under CCG. I don't think anyone's looked at them. I do think they are positive. I'm not saying that because I intend or I have an expectation that they change, but we must make sure that our expectations between the two parties are common, and I'm not sure that they are universally understood currently. The other thing is we need to ensure that the forward programme of HASC is full and complete. So it is really, really important as we move forward in our joint commissioning that we absolutely provide that information to Democratic Services and yourself, Chair, so that you have a good overview. That's all I want to say at the moment. What Paul has said, you know, I absolutely can see. I absolutely agree with most of it. There's some of it. There's a gap for me, but I'll never be able to get to the bottom of that. Thank you.
Thank you, Leanne. And the point you make about moving ahead positively, I think, is really important, and training. But obviously, the key point today is HASC and the process, whether it's outside agencies or internal agencies, and any tightening up of that would be really helpful from internal and external. We certainly hold the external ones to account, so that'd be good. Councillor Murray, because I know you are mentioned in the report as well, are you okay if I just bring you in? Paul, if you did want to comment back, and then we got onto the questions after, I'll just bring Councillor Murray in.
Yeah, thank you, and thank you for inviting me this evening. And I've already, as Paul and ICB colleagues will know, raised my unhappiness that this procurement took us effectively by surprise with the inclusion of children's services. And I thank Leanne for her positive explanation, but want to make a number of points. First of all, politicians wouldn't expect to be involved in the strategic board meetings that you have mentioned, but I do expect to be kept up to date, and I am. The chronology on page 31 shows how this narrative suddenly changed. You can see that in the early part of this year, the inclusion of children's wasn't mentioned and wasn't mentioned and wasn't mentioned. The fact that there'd been tacit agreement about the need to transform the services, about the need to look again at children's services, the split continued down until about April, May. And I was content with that because the services are very different. And anyway, my responsibility is around adult services. But we'd been very, very conscious all along about the difference between adult services and children's services, and about the way the children's services had developed in Medway. We have developed very specific co-designed services for some elements of children's community services in Medway that are not replicated in Kent. And when we started to hear this sort of seamless change of narrative about wanting to achieve equity, that's when our radar went up, when our commissioners started to get very, very worried. Because if you're achieving equity, desirable though that might be, and I don't dissent from that, from the ICB's point of view, Swale is an extremely challenged area. So doing the commissioning on lots, with us in a lot with Swale, puts a huge amount of pressure on that particular lot, and indeed on equity across Kent, because in the other three, there are fewer children. So in the Medway and Swale lot, there are more children. Both areas are challenged, with Swale being, in some respects, even more challenged than Medway. So the potential losses to Medway became a real issue for this council that should have come, in my view, to children and young people's scrutiny at a much earlier stage so that we could see that. And into the mix came a very good presentation. People in this room were present at it, and I was too, from the ICB about the recommissioning of children's mental health services, which we were all very pleased to see. That seemed extremely positive. We've now found ourselves in a situation where that extremely important piece of commissioning, in a service where waiting lists are huge and demand is growing, has been paused while this piece of commissioning slips into what was already going on with adults, creating a huge piece of commissioning, bigger than any other, going across the system in its entirety, with mental health services paused, which I find, I would like to understand how that decision has been made, given that the children's mental health services are so prescient. And overall, if we think about the ICB and our part in it, a health and care partnership where we've tried very hard from both sides, Paul and I will share tables and meetings very often, and from the get-go we have emphasised the importance of being a partnership, of being about health and care, about the council, about politics, and about the health service itself working together. The co-design that could have come prior to this re-procurement and prior to the consultation that has happened, in my view, at an unwelcome time of year for families. I know that this paper says the greatest chance possible to reach the biggest number of people has been taken. But when you come down to who has actually participated, it's a very tiny number of people who I think would have struggled to know what they were actually being asked. That has all happened when there could have been a period of co-design amongst practitioners to think about what we wanted from these services, how we would really achieve equity without detriment to anything that happens in Medway. And at the end of the day, we are here, our HASCA is here, I am here, Leanne's here to stand up for Medway and to make sure that the children in Medway get the best possible service. And that will, I'm afraid, always take precedence over any other involvement that we've got. So I'm pleased that we're going forward on a positive note, but I don't think that we should forget how this sort of seamless move happened. And I think, I'm looking forward to hearing what Scrutiny have got to say about this, because I think understanding what happened is going to be very critical to us really having the positive way forward that Leanne has outlined tonight.
Thank you very much, Councillor Murray. Paul, would you like to come back briefly? And then I will go to scrutiny members, because that's where I'm sure, as Councillor Murray just ended her words, was that we want to hear from scrutiny members, and I'm sure you do as well. Paul, would you like to respond on what you've heard?
Just a couple of points of clarification, if I may, Chair. And sorry, I know I'm not here to ask questions, but it's probably quickest if I do. Leanne, the meeting you talked about, is it the meeting of the Thursday, the 23rd of May? So you described that as an ICB meeting, but the minutes capture it as being a tripartite meeting. So the minutes capture it as being Kent and Medway NHS, Kent County Council and Medway, and as you say, it is chaired by you. Do you recognise that? I have a copy of the minutes.
The Kent and Medway Children and Young People's Programme Board, as far as I know, is made up of KCC, Medway, NHS, and it's a formal board of the ICB. That's what the terms of reference that I've seen say. If that's not the case, then perhaps we could pick it up outside, but certainly that's what I've seen.
I think it's a formal committee of the ICS, because that's why the tripartite arrangement is there, and that's why it's chaired elsewhere.
Okay, I mean, just look at, I don't know, I'll have to get the terms of reference.
Sure, okay. And sorry, just other points of clarification. I absolutely think that the commissioning, the recommissioning of children's and young people's adolescent mental health psychiatry is really important. I apologise, I wasn't aware that we were going to discuss that tonight, so I'm not in a position to be able to respond on that issue.
Thank you, Paul, and it is important, and I think we'll keep it on our radar to make sure we do bring that up when we call you back very shortly, because I think it is an important aspect with you and your officers that was brought up. I think going forward, I'm just about to come over to you, Councillor Joy, from welcome from CYP. I think what we've heard tonight is different opinions, but hopefully with the same forward-looking approach of trying to get a positive outcome here for our children in Medway and a fair outcome. I think that's where we both come from. There's also been the talk about training and the talk about making sure that HASC is alerted when needed to be. I think we need to move on to the questions, because I feel that's the important part, because obviously tonight the option for this HASC is whether a substantial variation is going to be applied. So is that okay from everyone that's spoken? Is that okay to move on? Okay. Councillor Joy, you've got some questions.
Thank you, Chair. With regards to this is the first time that I've actually seen anything on this. I can understand the timelines saying that children's services were added in quite late, but it highlights a lot of concerns for me sitting on the Children and Young People's Overview and Scrutiny Committee with regards to what benefits there is really to the children of Medway, and I understand that the children's part is for Medway and Swell, but ultimately our concern is for children in Medway. So I do have a few questions with regards to that. The first one is SEND inspections found waiting times for children's therapies and neurodevelopmental pathways to be unacceptable. As a major partner in the upcoming monitoring visits, what assurance can the ICB give that these waiting times will be addressed if the procurement is on an as-is basis? Given the contracts were last let in 2018 in Medway, waiting times have increased steadily across all providers year on year, and there's been no increase in investments in 2018 despite referral increasing more than threefold since 2021, since the pandemic. That's my first. The second question is, following on from that, I see from the consultation website there's no plan to cut investment. Is there a plan to increase investment given the significant waits that existing currently for children? Will the ICB be seeking financial efficiency for these contracts? Another, consultation and co-design is a crucial part of the S&D inspections. Due to the significant interdependency of children's health services with education, how many Medway schools have been consulted for this procurement? Because being a governor for a Medway school, stuff like this normally gets shared with the Board of Governors, and I've not seen anything on it. And my last thing is that there is comments on there's no cut in funding. But as I said, our priority is Medway. What assurance can you give that Swell will be coming into the partnership at the same or a higher level? And if not, will funding be provided to raise them up to the level? And will there be sufficient funding across the board for Medway and Swell, or is it just going to be at the level at Medway? Thank you.
Thank you, Councillor Joy. Let me try and address those in the order you've raised them. The provision of services for children and young people who need SEND services is a crossover between mental health and physical health. So services are provided out of both. I think you're absolutely right that the waiting times, and this is a countrywide problem, are way too long. People, families and children are particularly waiting too long for diagnosis and definition of diagnosis. But as Leanne raised earlier, we've had a very positive review of the SEND provision. That's a review of our joint provision. So I would anticipate that there will be development in the physical service, development in the mental health services, and that will be a really important part of the offering going forward. If I take your question 2 and question 4 together, which is about the funding envelope, you raised the issue about what level of investment will be forthcoming. Can I confirm staying as we are as a minimum and increasing preferably in Medway and equalising that in Swale? We don't know that yet, because until we go to market and until the offer is made and there's a number of parties who will bid for that service, we will take into account the level of investment that's there and how that investment is spent by whichever party or parties is successful at securing the offer. Your third question, which was back to the really important role that school governors play and that you're a governor in a Medway school, I'm sorry, I don't know the answer to that, but I would find out outside the meeting.
Councillor Joy.
Thank you. Your answer to questions 2 and 4 is very, very concerning to me. Not knowing what funding is going to be there and what you're going to put towards that just sends alarm bells ringing. I know that personally I don't get a vote on this committee, but I would be very, very concerned on the answers. At the moment you're going out to a tender and you don't know what's going financially into this tender to make sure that we pull in at least them areas that are major concerns, as you said, across the country. And there's no plan, because without the financial planning now, even on a budget type, because as a company, if I go out and I'm looking at things, I'll have a price bracket between two numbers, which hopefully closer to the lower number, but in the worst case scenario, at the higher number. If you haven't got anything like that, it just means that there's a lot more work to do on this. Thank you.
Just to come back on that, like the rest of the NHS, the financial envelope is not set to cover the duration of this contract. So this is a very long-term contract. Our funding windows are 1 year and 2 years in advance. But what we will be in a position to do in terms of confirming the funding is when we award the contract, we will be able to answer that question. I don't think it's that we have no idea. We would start from a baseline, but what we have to be clear about is what bids we get in.
Thank you, Councillor Joy. Councillor Mandarakis, can I go over to you, please?
So I've got 3 questions from that. And the first one being, how many children and young people have been consulted as part of the commissioning process? So that's not how many surveys on children, it's specifically how many under 18s have come back to those surveys. Considering that this is currently the largest commissioning exercise in NHS nationally. And then it was, what's the rationale of it being Medway and Swale? Like, why not Medway and Maidstone? What was the decision-making process in making it Medway and Swale that went together? And then there's lots of talk, it's similar to Councillor Joy's question, but there's lots of talks of how this won't be a detriment to Medway and things, but I can't really see how it benefits either. If we have it in place and it's working well, why change? Like in terms of for Medway, why change? Thanks.
I think that there are parts of the present service that are working well, but it's not uniformly working well. And I come back to Councillor Joy's question about SEND. I think that the way that services were set up reflects, as a minimum, the way that children's physical health services were created 8 years ago, by the time the contract is awarded 9 years ago. And there are more modern and more effective ways and different types of staff who can do different things with children and families, and that's what I think we need to modernise and re-provision. Albeit that we're very clear, and I know it's been before this committee before, that the contract will be awarded for the first year on an as-is basis, and that transformation will take place during the latter years of the contract. Why Medway and Swale as opposed to solely Medway? It reflects the conversations that we had with officers of the council, and also we are organised geographically in 4 health and care partnerships. It gets a mention in the paper, and those are logical groupings. There is, and we don't get this right, by the way, but there is a level at which you can use and attract the best skills of workforce if they are looking after a population of a certain size. And I think if Medway has stayed on its own, rather than be grouped in with the demands of Swale, that the ability to attract and to retain staff to deliver high quality services may have been impacted. So, and we've seen that, and I've sat in the audience of this group when you've talked about the inability of community services to attract and to retain some staff. On the specifics of your first question, precisely how many children and younger people under the age of 18 have taken part in the process to date, I apologise, I can't give you that data. I wasn't aware I was going to be asked that, but I'll absolutely take it away and send a note on to the committee afterwards.
Just for clarity, Paul, just so all members know, obviously there are questions you may not be able to answer, but we will be asking them for a briefing paper for members after the meeting. Is that okay? Because we will want the answers.
Yeah.
So I understand from a helicopter view there may be some intricate detail you can't tell us, but any of those ones you can't, then can we make sure that we get a full briefing note with them answers, please, Wayne? Is that okay? Thank you. Okay, Leah. Just Councillor Wildey, I'll come to you.
Thank you. On page 28, on the number of people that have been involved in the consultation, second bullet point, 175 people signed up to attend 8 events. Of those 175, how many did attend? Because often there's quite a difference between the numbers. And then I'll carry on. Do you know that number?
Sorry, no, I don't know that number.
No. It's just, if you go to, page 27, the number of services being commissioned, you've got 22 adults, 27 children's, even the 75 number does not work out at very many people from each service. Do you know whether somebody from every service has attended a consultation and given their views?
No, I don't.
Okay, sorry, but that's disappointing in my view, and I'm sure in yours as well, because I do know consultations are difficult, but...
Well, sorry, Councillor Waddy, I wasn't aware I was going to be asked questions about the consultation this evening. When I was briefed for the meeting, it was about the process.
Okay, well, I'll move on to a process question. Given the paper says the ICB seeks to provide consistency to the contracts and procure based on local needs rather than historical services, what needs assessment have you, the ICB, carried out for this procurement?
So the needs assessment would always be based upon the very comprehensive process that takes place every year. We have a comprehensive needs assessment in conjunction with colleagues in public health. We also supplement that with the feedback that we got from the people who have been involved, from the organisations who presently provide those services, from the voluntary sector organisations who are involved, from the families and from the family members. So it's from a multitude of sources.
Thank you, but just now you seemed unsure of the number of people and the voluntary organisations you'd spoken to, but can you tell, what's the normal process, the normal time frame for carrying out a commissioning, recommissioning process for this number of services?
Sorry, can I just return to your previous question? So you think I was unsure? I thought the paper was relatively clear in terms of the people that we had spoken to. I couldn't give you the exact answer as to how many individuals from the people who had registered to events.
No, nor either if all the services had been spoken to, all the individual commissions served, but but as I say, my question carried on.
Sorry, would you repeat the question? Apologies.
I've lost my thread now,
Sorry,
I must
apologies.
admit.
I'm sorry, Councillor.
How long will the process take?
Sorry,
Councillor
I'm being
Wiley,
prompted
shall I
by...
come back in a moment to you? Do you
Sorry.
want me to come back to you in a moment?
Yeah,
Well,
please, thank you.
Sorry, Mike has just prompted me on my left. Sorry, apologies, Councillor Waddy.
No, that's fine.
I think your answer, or the question, apologies, was how long might a standard re-procurement
Thank you, Mike.
of something of this nature take? There isn't a standard process, but what it would do is it will take months and sometimes many, many months.
But that doesn't appear to have happened this time.
Well, the process started earlier this year, and we are likely to award the contract in 2025, so it will run into next year.
All right, okay, thank you.
Paul, just for clarity, just to obviously defend my members on HASC, when they read the report, there was detail about consultation in the report. So obviously, members will ask the question. I totally understand if you can't give us that detail this evening, but members asking detail from the paper itself, I suppose there's the expectation of them knowing because it was included in your paper. I know only briefly, but it was included. I just wanted to make sure that we can get the numbers, Councillor Waddy, but that's why you may get questions on some of the comments you've made in the paper. It's only fair for members to do that. Councillor Cook.
I think we're working. Wonderful. Thank you. And I think part of the kind of questions for us tonight about understanding the big picture and the strategy and recognising the way that that will then inform these kind of specific details and the reality of people's lives. And it's such a long journey, isn't it, from setting this kind of groundwork now around the protocols and the principles. And I think the finance is a really good example for us to then understand what this is actually going to look like for Medway. And so I wanted to ask a question about kind of gap analysis and what's been shown around kind of the current services, the waiting times, performance levels. What's then going to need to be in place in order to deliver on the ambitions? What are we actually looking at needing to happen? What's the gap analysis shown? And then I was really taken by what Councillor Murray was sharing about equitable outcomes. And I think, you know, that's a really interesting example around the specific needs of our areas. And I think, you know, just echo that we don't believe that that can be achieved by attempting to offer the same services to all children and young people. And so how do we know which populations need more targeted support and what that targeted offer looks like? And how can a bidding provider be certain? So I'm thinking about things like equality impact assessment. Will that have been completed? So just a bit more there around the processes and what we can actually be sure about what we're going to receive. Thank you, Chair.
Thanks, Councillor. So a really important step of that was that at the turn of the calendar year, the three sovereign bodies, so NHS Kent and Medway, Medway Council, Kent County Council, approved our strategic forward view, and that was built around addressing the very issues that you describe, and it's really important. So it was addressing life inequalities and moreover recognising to a level that hadn't been the case before that the NHS is a part of the solution of that, but those life inequalities are driven by multiple other things, and that was why it was so important that that document and that strategy was approved in January. You asked for perhaps a couple of examples about gap analysis, because I think that's really important. Maybe to give a couple of examples. The way that we deliver healthcare was changed enormously as a result of the pandemic. And so it is absolutely normal now for some services, for example, to be delivered through a digital channel rather than a face-to-face channel. And we got familiar with that, and we found that was useful. And the outcomes, whilst there isn't a great body of research on that, is that done in the right way, done in an inclusive way, those digital opportunities can be as effective as other services. We also, as an example in terms of gap analysis, is that we have identified, and not unique to Medway, but keeping the conversation on Medway, that the impact of the pandemic has been enormous in terms of the numbers of people, young people, children who are going through the school system and who are dropping out of the school system. So we need to provide a different offering than the one that we had before the pandemic. So put in very simplistic terms on my part, I apologise, the role of a school nurse is much more these days about the mental health and well-being of the students who are in that particular school or educational institution than it was before the pandemic, because of the levels of people who are not going into school each day. And the ability to pick those individuals up and do the work to repair their mental health is absolutely central.
Councillor Cook, do you want to come back?
Yeah, thank you. I really appreciate those kind of examples. I think that's exactly what I'm saying around being certain that when we are going to procurement, that is going to be built into the process, so that, for example, the digital offer, the best offers are there. Because, you know, an example that you've given their school nurses, I don't actually think that a number of schools even have school nurses in the same way anymore. You know, the way that budgets are, the work of academisation, role of mental health first aiders, for example. So how can we be certain that what's needed, and I think, you know, Councillor Joy gave the example there of the kind of long wait around diagnosis, for example. How can we be certain that in this procurement that is going to be addressed? Is that being built into the process? Thank you.
So absolutely, and I understand that at a point the proposal about what the service would look like was going to come back here to be subject to scrutiny. So I think that there was an early conversation about the route that we were on, but at some point what is being proposed would come back. And I think you're absolutely right in terms of how we could pick that up and make sure that service is there. But what I would add to that, and it is to add, is that we're looking for a long-term provider, multiple years, And I absolutely recognise that in a contract of multiple years, what we start off with will not be what we end with, because it needs to morph and it needs to change as we go along. And that is what good healthcare provision can look like.
Councillor Cook, are you satisfied? Did you want to come back once more?
Thank you, Chair. Yeah, just a little bit more then around the targeting, my second question around the targeting of particular groups and how that might work. Thank you.
Could you just unpack the question a bit?
So I think
it
was just, I was really struck by what Councillor Murray was saying in the beginning about having a kind of blanket offer for such a huge group of people, and how are we going to be certain that we're targeting the right groups of people, and that question around the equality impact assessment and making sure that services are going to the right people in Medway. Thank you.
So, starting at the end of your question, and apologies for having to ask for clarification and starting there, will an equality impact assessment take place? Yes. And will a quality impact assessment take place? Yes. And I would absolutely want to share both of those documents with this group and with other overview and scrutiny organisations in Kent. The technology increasingly is getting to a point where we can be much better about targeting those outcomes. So the ability to do things that we couldn't do 5 or 10 years ago. So I'm thinking there in terms of wearable technology, the ability that you have now in terms of wearing something on your wrist or elsewhere that gives you certain information that actually years ago wasn't there. The fact that actually if we do it right, and I think this is really exciting, we can have a genome profile of every child born in Medway, and that technology is available. That's now, that's not science fiction for the future. And if you can do that, then you can work out what's the best way to look after that child as they grow through. And what you can then start to do is to avoid some of the things that we know are affecting our children and younger people. So the significant spread of diabetes, weight issues, mental health issues. If we can pick that up, we can proactively address that.
Thank you, Paul. Councillor Cook. Councillor Amadishe. Paul, if you could just turn your mic off, please, and Councillor Amadishe, turn yours on.
Okay, is that better? Okay, fantastic. Thank you for your feedback thus far, Paul. I want to talk about the practicalities, of which my questioning will revolve around 2 key themes. One, frictionless pathways, as well as seamless pathways. There are 2 local authorities in question here, is Medway and Smell Patch, which have interdependencies across education, public health, social care for children's community services. In Medway, we have a coterminous joint commissioning team. Commissioning on the Medway and Small footprint could have resource implications for children in Medway particularly. How does the ICB propose a workable, collaborative, practical approach to ensuring what I talk about, the seamless pathway across both local authorities to benefit children in Medway? And I just want to frame it around what is happening right now. We have young people receiving care, particularly on mental services, living in Swell, that are transferred to KMPT services, such as in Britton House. Depending on how that care goes, that young person could be transferred back to Swell to receive care from an organisation close to where they live. So in terms of seamless and frictionless, I'm talking about the practicalities, what we're going to be doing to make sure that the family members, the young people, and the staff across the NHS can work in a cohesive way, what practical things can be actually done. Thank you.
So I would start my answer by saying that I don't think we do that very well at the moment, and I think it's one of the things that we could do better. And I think you're absolutely right in highlighting that it works at a number of different levels. We are not very good, particularly at transitions for younger people as they reach adult services. So in terms of the practicalities and picking up your steer, what we are trying to do at the moment and working very hard on is to define a strategy for the NHS in Kent and Medway so that all organisations in the NHS family can work more effectively together. But I would also loop back to both Leanne and Councillor Murray's earlier testimony to the committee, which is if we build on what we have done thus far in terms of the work of the integrated care strategy and the partnership that sits within it, I think we have a better opportunity to do that, because I see the early green shoots of how that can work effectively for the people that we serve. And I think there are examples, and it just may be helpful to give you one or two examples. Physical co-location of services where people from other parts of the NHS all sit in the same building, and very excited about Chatham Healthy Living Centre as a worked example of that. And the conversations, and you identify them, that we have been having with Kent and Medway Partnership Trust, the mental health services provider for adults, and about how we can more effectively join that service with the CAM service, are ongoing and live. And as we award contracts in the future, one of the tests will be, how do you make those transitions seamless so that the families and the young people would not know that they're transitioning?
So can I come back, please? No, thank you very much for that. Just to build with you on some of the concepts you raised to support what you're saying, or for me to clarify what's actually happening. There's something about technology you raised, and if we look at technology, should enable us to have a faster feedback loop, so we don't have to test things in the wild at the expense of young people's health and well-being. What sort of tools are you using to model these new pathways with the technology, so you can see the journeys in not only distance, in time, in practicalities, before you go to publish, this is the way that we're going to actually work moving forward?
By and large, some of that technology is already there. It's not perfect, and it should be matured and it should be iterated. The increased use, and I think it's valid in young people, but I think it's valid in all the people that we serve. So the increased ability to use apps, the increased use of smartphones, as you say, using some of the technology in terms of chatbots to get a response, that technology is already there. And as we test the process of awarding the contract, we will test that the people who are coming forward have the ability and the capacity to deliver those solutions.
Sorry, just the last one. Sorry, just to keep the your feet to the fire a little bit on that one. I'm talking about not technology to replicate paper. I'm talking about technology so you can model your pathways. Modeling your pathways in an environment where you can actually stress test it, thinking about the resource implications, the costings, the time, and all of those factors, and then coming up with how the technology, the consumer-grade technology or hospital-grade, can be used to complement. But if you've got a feedback loop that says, you got all this technology, let's roll it out, but the practicalities, which I talked about, to get rid of this frictionless, to get to a frictionless state of working, you need to model it first.
I absolutely agree.
Thank you, Councillor Mzishi. Thank you, Paul. Councillor Jackson.
Thanks, Chair. I just want to go back, because it's really bugging me what Councillor Murray and Councillor Joy brought up right at the beginning, that this this lack of investment and funding, that we don't know where it's going to come. Swell is, you know, in need of resources more than Medway, and if Medway, we don't even know where if this funding's guaranteed. How do we know that our children in Medway's services aren't going to get diminished? Really, I mean that's the big question that, you know, we need to know that our children are going to be looked after, and we don't even want it as it was. We want to be striving that we're going, you know, we're meeting new heights, and I feel like we can't do that if we don't know what money's coming in. We don't know anything's being guaranteed.
So the operating budget of the Integrated Care Board this year is £4.2 billion. It will go up. It will go up in line with inflation. There will always be a series of demands upon that, but I don't accept the premise that we don't know that there's going to be enough money to do it. We will have to make decisions about what we invest in, but I can absolutely guarantee that there will be investment.
But at this moment in time, you can't guarantee that Medway Children's services will not be as the standard that they are now, because SWAL is taking some of the resources away from Medway Children.
No, sorry, and I apologise if that's an understanding of the committee. We serve the whole of Kent and Medway, and the debate here in terms of this proposition that's in front of us is not about robbing Peter to pay Paul. It really isn't. It's about coming back to Councillor Murray's observation that we need to target the investment at the areas that need it the most, both in terms of health needs and numbers and growth, but this isn't about taking money away from Group A to fund Group B.
I mean, as long as that's fine, thanks.
Thank you, Councillor Jackson. Councillor Brown?
Thanks very much, Chair. Actually, I want to come back on several points, and they're all kind of interlinked, but they're all around the money. First of all, if this is a joint procurement with Kent and Medway, Swale and Medway Children's Services, am I correct in assuming that that is the case? This is a joint procurement for services for Swale and Medway.
Sorry, I'm not trying to be slow. I just need to understand what you mean by a joint. So the proposal at the moment is to procure children's services for Medway and Swale.
So it is for the two areas. It isn't for Medway separate from Swale. So it is joint. That's what I meant. Right. If that's the case, and we know that Swale has got certain challenges that may not be the same as in Medway, and you're going out to procure an as-is service, by implication, I'm worried, because that means you are taking a pot of money and you're sharing it across a bigger area, one part of which is in more need than the other. And I'm not representing the one that's in more need. I'm representing the one that looks like it's going to lose out. And that's the assurance I think that this committee is worried about. That's a point, and I don't know how you're going to square that circle, and you probably can't tonight, but I do need to come on to a few other points about the finance. So if we can be agreed that it's agreed that it's joint and it's one pot of money.
I think absolutely agree that it's joint and it's one pot of money, but I don't recognise and understand the premise that therefore the money will be less than it is now, because the as-is procurement will equally apply to Medway as it does to Swale. So I'm not talking about taking the money that at the moment is funding the Medway Children's Services or is funding the Swale Children's Services, and that we would only use it for Medway and Swale. I'm saying that what is funded at the moment for Medway and for Swale will be invested in Medway and Swale.
Yeah, but the point is, Swale has more need than we have, and their services are in more of a dire state than we are. And therefore, if you've got the one pot of money across the thing to spend it, you're going to procure a service that is spread across a bigger number of people, but you've got the same amount of money. Am I wrong?
I think the fault is mine in not understanding. We have an amount of money that we spend on physical children's services in Medway and in Swale, and the commitment is that we will procure an as-is, so we're not going to take investment out of Medway or Swale.
I leave that parked. Thank you. The PIN is published, but without a financial envelope, and I think you went some way to explaining why you're not doing that. And then you went on to say that you kind of could estimate how much you will be spending over the period of time if you apply the formula of the money being increased. But my problem with this is you have ambitions, and rightly so. You've published ambitious documents and developed about the transformation. And I'm just worrying about the real risk here of creating a level of expectations that providers may not be in a position to meet. How are you going to mitigate against that? That's one question about that.
I think at a very headline level, the way that we mitigate against that is that we absolutely test to the very highest levels of stress that the people that we appoint to provide the services can do it, and that they have the creativity and the ability to change as the circumstances change. And then once we are in a position where the contract has been awarded and is in situ, what we do is that we manage that contract and we hold to account the providers of that contract to make sure that they are delivering, with the proviso that any contract needs to have enough flexibility so that it can react to the circumstances that are there at the time.
Sorry, that just leads on to an obvious question of, so within the contract, will there be reward for the journey on the transformation pathway? Because if you procure an as-is, that's fine. But if I'm the provider and I haven't got the money to do the transformation, then I won't be able to do it, even if I wanted to. So that's great. Thanks for the answer on that one. Who'll make the decisions on whether you'll cut or invest across Kent and Medway, and where you'll cut or invest, please?
Ultimately, the decision will be that of the ICB board, because it's the board that has the statutory authority, but they will take recommendation and advice from the executive, which will include the clinical views. So we have a chief medical officer, a chief nursing officer, and they will be absolutely central to the decisions that we make. And coming back to a colleague's earlier question, decisions about investments and disinvestments, which we have to do, given the financial positions that we're in, are informed by quality impact assessments, and those quality impact assessments evaluate what is proposed and the impact on the people we serve would be.
Will that come back to any of the committees because of the interdependencies between public health and nursing, education and social care? I'm just trying to kind of understand the decision-making process and the timetable and the reporting back. Because if we've got to make amendments within other services because of the consequences of either more investment in one area, cuts in another, whatever, but the balance to be struck and to be fair to our residents, is that going to come back to politicians or not?
We would absolutely come back with anything that was in the purview of the HASC and of the HOS. So there's a defined set of things. But to answer your question, which is how I would like to work, I think one of the benefits of the Integrated Care Board is that it has partner non-executives drawn from the local authorities. Leanne is the nominated officer for Medway. We have an equal person from Kent. We have people from the voluntary sector. We have people from primary care. And so what I really value about that is it is the board that is informed and influenced and has those decisions when it's has those individuals when it's making those decisions.
Sorry, Chair, I'm almost shut up. We just go back to the as-is and the transformation, yeah? And I accept that writing a spec like this must be near impossible, but delivering it is impossible if we don't get a few markers in the ground. And I was just wondering how far down the line are we in, I know we're going as is, that's the easy bit, but how far down the possibility of modelling and various other things are we to identify the transformation journey? I'm not suggesting that we know how we're going to deliver it, but this is just to find out a little bit more about the journey to the transformation, please.
So I think there are examples where that is done well, almost in all of the organisations in Kent and Medway. But what we don't do, and picking up your cues in the question, is we don't do it rapidly enough and we don't do it well enough uniformly. So one of the tests that we are putting into the spec is how does that transformation work and how do we make it work so that we learn quicker from the things that go well and that we enable them across the piece. So I think if you have a good contract and if you have a good partnership and collaboration with whoever you are working with, you can do it, but you have to have the ability to have a long-term relationship, which is why I'm very keen to have a longer-term contract than we've had thus far.
Yeah, I get the long term. I get the theoretical need to be in collaboration. I'm just wondering, and it may be that you haven't started the journey, but I just wanted to know how far you were on the journey. That's it.
Thank you, Councillor Brown. I go to Councillor Prenton and Councillor Nain.
Thank you. It might sound like repeating ourselves and asking lots of questions about investment, but it's obviously a concern of the committee. Myself and the committee are pleased to read, for assurance there is no plan from the ICB to change the services or diminish access to services for citizens in Medway, whilst looking to improve the equity across the ICS footprint. However, is there any intention to increase investment into these services? And can we be assured neither resources nor finance will be removed from Medway to prop up the lack of resources and investment to Swale? For example, the speech and language therapy service is already over capacity in Medway. This team cannot simply be split across Medway as well to cover a gap in secondary school age provision in Swale.
Thank you. Absolutely right, and I reiterate the commitment in here, which is that there won't be that removal. What we do need to do, though, is in occasions we need to reinvest some areas. So we need to rebalance on occasions, and that will mean taking some money from there and putting that investment in. I absolutely commit to keeping the size and the scale of what is going in at the moment at the point it is. That would not change. But if you take an example that we've already talked about this morning, we have a real issue about the mental health of our younger people. And we have a real issue about the length of time that children and families are taking to get SEND assessments and acknowledged, and we all have a part to play in that. So there will, I anticipate, as there is in any organisation, be moments when we have to take investment decisions about where do we find the extra money from, because it's been really clear, and I do understand it, it's been made really clear that in terms of the public finances, there is not going to be a significant major investment in the NHS. There's going to be the manifesto commitments, but no more. So we will have to find ways to spend that money more smartly and more effectively. I would like, and just to offer you an example of that, by having the right contract in place, by having a longer term contract in place, by having real clarity about who provides what and when and how, I hope what we will be able to do over time is to shift the amount of money that we spend in the back office into the frontline clinical services, because that's what I would like to do. And perhaps, sorry, apologies, but just as an example of that, in the last year, we have reduced the running costs of the Integrated Care Board by 20%. So we have gone through a redundancy programme, and this year, the financial year that started on the 1st of April, we will reduce that by a further 10%, and that is money that we are keeping in our allocation so that we can invest that into frontline services to reduce the length of time that people wait for services.
Yeah, that sounds lovely, and you know, a lot of that, and you can work differently, work smarter. But when language like rebalancing, sometimes you said at the beginning you're not going to rob Peter to pay Paul. Rebalancing can sometimes turn into that. So that's something that and you're saying the budget isn't particularly going to be increased. How are you going to make sure that you don't end up robbing Peter to pay Paul? Instead of, if the smarter working doesn't turn out or other pressures come on, that you're going to not rob Peter to pay Paul?
I want in the middle to longer term to do things that mean that we have a healthier population. So we are spending money in the health system in Kent and Medway every day that I think could be better spent elsewhere. So I'll give you an example. It's not related to children, but I think it's trying to address your question. Today, we have more than 500 hospital beds that are occupied by people who the clinicians say would be better looked after somewhere else. Now, that has a massive impact, and you've heard evidence at this committee about the impact on the ED in Medway Hospital from my colleague, Mrs. Black. And if we can get the size of the hospital estate to the right place, the most expensive way that we look after people in the NHS is in a hospital bed. It is genuinely the most expensive. It is far better to invest in these sorts of services that we're talking about, to get upstream, to prevent ill health, to make sure that we address the needs of children so that they don't develop type 2 diabetes, obesity issues, mental health issues. If we can keep them healthier and do the prevention work, we are going to be in such a better place in terms of their health and well-being in later life. So I would like us to invest in prevention, to get upstream of things. I'd like us to make sure that we right-size the hospital so that we've got the right capacity and people are not waiting for unacceptable levels of time in EDs. People aren't waiting for over a year for operations, but that we actually make sure that people are in the right setting, because it's not good for the people we serve when they're in the wrong hospital setting.
Thank you for that. Yeah, I do agree. But it has been a problem all the time I've been a councillor, and it doesn't seem to be going away, but hopefully that changes. If I can ask now, if that's all right, Chair, just on the independency of services between Medway and Swale, there are significant independencies across the Medway and Swale patch. For example, Medway have an integrated 0 to 19 contract for public health nursing and children's community health. This model was held up as best practice by SEND inspectors. What consideration has been given for these independencies should a different provider be successful?
To my answer to your colleague's question earlier, when we go into the first year of the contract, we will keep things as is. So those things that work well, we will continue with. But what we'll do is we'll work with the providers to say the things that we can do better. We won't change things just because people want to change things. We'll only change things because they would be better, and we should learn from those really good examples. I think the SEND review was an example where there were lots of good areas of practice that we would learn from, and I would continue to do that.
Yeah, if you take best practice for everywhere, that's expensive. So if you're not doing it already over there because they can't afford it in Swale, for instance, the best practice will cost more to do it in both areas. Would that not be correct? Sorry.
I'd adopt an optimistic and forward-looking stance that actually best practice is sometimes the most effective in terms of cost. So if you get the thing, whatever happens to be in health, right the first time, you spend less because you get it sorted out the first time. We spend too much time and too long waiting for things to happen and reworking things. So I think sometimes best practice can also be the most cost-effective practice.
Thank you, Councillor Brenner. Councillor Nain.
Thank you, Chair. First of all, I would like to ask if we talk about procuring as is. I believe it's you procure the service as there is a need for it. So if we look at the current demand and complexity of cases, and then when we look particularly with special schools, waiting list, which is around 4 years for neurodevelopmental pathways and therapies, and we are talking about procuring as is. Don't we think with the current backlog and with the all the surrounding issues, are we not still leaning towards historical services, as you don't have any model that you are using to look at the future what is like what direction you are going in the future, because there is no model, there is nothing that you are using, but we are using existing. I believe we are still using, because if we have a bad luck of maybe 4 years that we are looking at issues, are we still not using the historical services as compared to us is? And if we still believe we are using that, how would this current system meet current demand? And then not talking about future demands.
I think it's both and. So the commitment that we've outlined and is reaffirmed in this document is that for the first year of the contract, we would procure as is, but after that, we would start to go into that transformation process. And to the answer to your colleague's question, that transformation process has to be done with the people that we serve and with the organisations that we procure to do it. So I think the assessment that we've made is that the level of risk about trying to wholly redefine the way that children's services are provided without the new providers or a new contract in place, without having done that work with the families and the communities, presents too much of a risk. The benefit of having a longer contract is that we could do that transformation and we could address some of the areas of demand, because I would agree with you, we are not meeting all of the demand that exists at the moment. But the scale of risk about wide-scale transformation without having got some of the building blocks in place is a real risk.
So if I can understand, that means that within the first year of the transformation, it's still going to be more focusing on historical services. Because if within that transformation period, you're going to still be working on existing or using existing providers before you start to transform to procuring services from new people?
Sorry, no, and I apologise if I've confused that. So what we would do is that we would award the new contracts, but we would ask the new providers, who may be the existing providers, we're going through a market testing process, that they continue with the service as is for the first year, but that from the start of the second year, and there would be a build-up to this, that we go through that transformation process. So we would award the contracts, we wouldn't wait to do that, but we would ask them to continue with the as-is service, which is beneficial because one of the things that we would absolutely require every provider to do is to meet the 2P obligations. So the staff who are working in the services on the day that they move to the new contract will be the same staff. We will require the new providers or the existing providers to continue with those obligations.
Councillor Wiley, did you have a final question before it comes to me?
Yes. I would like to go back to, well, the listening events, the amount of consultation that's been done. On the children's services, it says in these papers, 2 listening events. Again, going back to 27 community providers, that doesn't seem enough to me. And all of these questions that everybody's asked simply points out that there aren't many answers in these 8 pages of the result. You know, this report is a very important subject, and there's 8 pages. You know, so obviously, from my point of view, and I'm sure many members, it will have to be a substantial variation so that we get more detail, the providers, the service users, all get their say, because going by these papers, that simply hasn't happened. Can you, I've asked before, can you tell me how many of the service providers have you spoken to, and you couldn't really answer? It just seems wrong that that work hasn't been done for where you are now. That's more of a comment than a question, but, you know, if you wish to come back.
So I think that your observation about 8 pages, I think, and sorry, you've been here, this is not the first time this issue has been in front of this committee, and there have been reports. And I would absolutely repeat my earlier point that I think there is an understanding that at the point at which contracts are further progressed, and that work is further progressed in terms of taking on board the views, that this would come back. Yeah, this is not a one and done. I think it's, in the last year, this issue has been here 4 times, and rightly, it's a very big issue. But just on your point, and Chair, with your agreement, in terms of the substantial variation, I absolutely understand it is a decision for the committee. The observation that I would make in addressing your question, Councillor, is I'm not sure that we're at the point yet where you can make that determination, because what we are saying, and the answer I gave to your colleague, is that for the first year of the new contract, there will not be any variation. It will be the service as is. I think that the point at which you can make the determination in line with absolutely your important obligations is the point at which we have described what the future service might look like, and then there's a process that would apply at that point.
Councillor Whitey, before you come back, can I just switch your mic for 1 minute? I mean, Paul, I must say that obviously we're going to touch on the SV once people finish their questions. Obviously, we seek our advice as well, and if we're unclear or concerned about a contract that's coming into play very quickly, we can make that decision. We did with adult procurement services as well, as you're well aware. So we have checked it. We can make that decision. The hope is to all move forward in a positive way. But I suppose I don't want to touch on the SV just at this minute in time. Let's finish the questions, then Wayne's going to come in and just clarify the SV so we know whether we make a decision on that or not. Whatever the decision will be, you'll hear that when we go.
And sorry, Chair, and thank you for that. I was partly trying to answer Councillor Wiley's question, but and I welcome that, and I'm not for a moment making any suggestion that it is not within the purview of this committee to make that decision. I was just making an observation that when we get to that point this evening, it might be helpful to hear from me about the views.
I mean, I've got some questions. I'm going to go to one more. Councillor Hamadishi, I'm going to come back to you, and then we're going to, just for those members to know, I'm just going to ask some questions, and I'm going to go back to Councillor Joy, Councillor Murray, and Leanne, just to close up before I come back to you, Paul. Okay, and then we'll look at the SV after that. Councillor Whitey.
Can I just make one quick point that the Children's has not been to this committee 4 times. Thank you. That's the adults. This is the children's. First time, 8 pages, 2 listening events. Sorry.
Thank you, Councillor Wiley. Good point made. Okay. Councillor Hamadishi, would you like to come back just quickly with a question?
Yes, please. If I may, just one last question. I know it's been on my mind for a while. This is to do with the grey area when children are transitioning from young people to adults. We're in the fortunate position here in our Medway where we have service provisions that cover both young people and adulthood. That does lend itself for a better way of working with young people. So my question is, what mitigation is in place when you have different providers winning adult contracts and not children contracts, and or vice versa, in relation to that management of the transition in state? You know, that should pique your risk register if they don't, A, have those provisions, or B, have a better way, a good, sufficient way of mitigating any shortcomings.
I would agree with you, but partially, because I think in terms of physical health, that is there. But I think in terms of mental health for children and young people, there is a difficult rough end transition because of the way that we've got the existing contracts between North East London Foundation Trust and Kent and Medway in terms of that. And the evidence is there, particularly in terms of the work that community paediatric services do, which you're absolutely right, is provided by one organisation. Often those children transition into other services. not physical health services. There is often a case where they transition into mental health services. So I would absolutely agree that it does and is piquing my interest in terms of risk, and we have to get that right in the contract, and I think it's something that we would test and use to test the veracity of it. It doesn't automatically mean that we go to have one provider, but if we don't do that, then you get into the debate about how can you assure that transition within organisations and intra-organisations.
Sure, just one last comeback in terms of that. We have a history here where we have outsourced services to South London and Moorsley. Now, Elft, is it called? Elft, yes. East London Foundation Trust. It's a trust completely way outside of borough. So this is why I think it needs to be on your risk register, the complexities and learning lessons when we've enabled other providers outside of our geographic location. Just when you look at the resourcing element, getting staff in that were used to getting London waiting in London, getting them across into Kent, that the lack of management of that meant people gave up on the jobs, and then that had a detrimental effect on the care given to young people. How are we going to evaluate maybe in a points-based system that, okay, if you don't have the necessary services in-house, how are you going to be weighting the point system to then say, okay, fine, how does it equalize?
I couldn't give you the detail of the points-based system for evaluation, but what I can do is to share with you some of the evaluation techniques that we will use to assess the bids that come in. What we've done is we will evaluate the clinical efficiencies, we'll evaluate the way that caring services are delivered, and that will go through a panel process and then a moderation process to make sure that the service providers understand what they are required to deliver. And then the contract that we put in place, or contracts that we put in place after the event, will reinforce the obligations to do that.
Okay, just my closing. So just to put it out there as a closing statement, there are nuances to some of our young people's presentation around their mental health that's unique to being Medway and Swell. And can you just make sure that that's safeguarded and those providers are aware of that? Thank you.
Thank you, Councillor Medici. And as great minds speak alike, it's following the excellent question Councillor Prenter asked. I was going to ask it and you asked it for me, so well done on that one. Paul, surprisingly enough, I mean, I'm going to sum up after, but I've only got a couple of questions, two mainly, really. And again, it just feels like a year ago again here. We're sitting, as you know, nearly a year ago we sat here with the same sort of issues around no figure on the envelope, right? Which leads to the questions, I suppose, the questions around risks and mitigation is very difficult if you're not putting a figure on the envelope of what your risks are and what you're going to lose and what you're going to gain, etc. So you may not be able to share that risk register today, but you must have laid out your risks and the mitigations of those risks, including provider loss, etc., etc. They must be there. And I still can't comprehend how the ICB doesn't have a figure, right? Because you're the chief exec. You will sit down with your management team. You will make sure, your board, you will make sure you know what your current budgets are, you know what you may want to save and adjust. There must be, and I'm not asking for it now, Paul, but we asked Lee Martin the exact same question last time, and I think it took a couple of weeks for us to get the answer. But I think one of the main issues today, concerning issues, is we don't have that figure. And I understand the intricacies of it all because of the NHS, etc., but you can understand that slight concern. It is like a year ago again. But I suppose the main question I want to ask you is about do you really feel that 3 months is sufficient time to fully scope this service and to pull it out? Do you really feel that, you know, and bearing in mind this was the same question that I asked your team a year ago, can they do this? And you know, I'll be interested to see your answer.
Can I answer your first observation and question first, Chair, and then come to the second? So we are going to enter into a series of contractual commercial arrangements with providers, whether that be with NHS providers, social care providers. There are various different models, and we don't go into this process without an open mind. But I can reaffirm that that figure will be what comes out of the end rather than that you go into. And I suspect that's not that different in any commercial negotiation, because what we have to do is to assess each of the submissions from the potential providers, and it won't be fully decided upon the financial envelope. It will be decided upon the quality of the service, the way that they look after their employees, how transformative they can be. So it's all of that. But I can absolutely commit at a point when those commercial discussions are concluded, and I can take advice on this, but I don't really see why there's any reason why we wouldn't be able to come here and share that, because that would be how partners work. That would be how we work in collaboration.
Thanks for that, Paul. It's easier just to fold that one over. I think we had that the last time, and then all of a sudden, before any of those for adult services, we had that comment, we can't give you anything until then negotiate. But then all of a sudden we did get that, before the contractual discussions were happened, we did get that detail, and we did promise you at that stage, I think officers remember, we went into a closed session because you maybe didn't want that announced in a public meeting, and we followed through with that agreement, and we said we would still like to see the figure, and only if we started to talk about the amount of money we would go into a closed session. So I suppose that reassurance for you to go back is that the committee, you can hear, are still very concerned about not knowing that figure, because the main issue is they don't want to see a drop in funding for Medway here and for our children. That's the crux of it for our committee. Not that we're not caring for children in Swale or children that are coming to Medway and then going back home to Swale, but really we want to make sure you've heard question after question this evening, making sure there's not a drop in funding. And I'm going to use that comment that two councillors made, including Councillor Brent and others, about that. I hate to say that rob Peter to pay Paul. I can assure you said you were not. I can assure you we're not. We don't know that if we don't see the figure, because if the current figure and the new investment figure, whether it's more or whether it's the same, the committee has to see that detail. Do you understand? I mean, it's not for something. I know you may have to go back like we did last year, go back and seek advice on it, but it's not. I think you can hear from this committee that it concerns. Councillor Brown was saying about the finance as well. It concerns when you don't see that reassurance of. It'd be like you coming back and saying we're dropping it by this amount of million. Then that's going to concern us, because it goes back to them questions of where you're going to make those drops or cuts or reinvestment. So I try and keep positive on that. Going back to my question about is 3 months sufficient to fully scope this service? Over to you, Paul.
No, it isn't, but it hasn't been 3 months. So this is an iterative contractual process that won't lead, that will lead to the contract being awarded in multiple months' time. We're talking about a go-live date that is next year, 2025. And so I think if you wanted to do this process from top to tail in 3 months, I think that would be too short a period. We've seen that a lot of work has been done in conjunction with colleagues, quite rightly. There's more work happening at the moment. That work will continue, and then there'll be a go-live contract. So I don't think 3 months is long enough, but I don't think we've been doing this in 3 months.
Thanks, Paul. I mean, I think I take into account your comments around with colleagues and doing stuff. I think the main issue you have is that HAS colleagues haven't seen that detail and haven't seen that work done. I know you've put some detail on the paper, and there'll be more to come, depending on the decision made this evening. But from us, this is day one of us knowing what's happening from this committee's point of view. You have to understand that's where we are from a committee, and asking questions and wanting answers and wanting reassurance. We're only on our day one with you from a HAS committee point of view today. Paul.
Sorry, I wholly accept that point. This is, and to Councillor Prentice's observation earlier, this is the first time that's been there. But your very specific question was, can you do this from top to toe in 3 months? No, I don't think you can, but we aren't at that place. Work has been done, we've been trying to put in place, and it will go much farther than the next 3 months in terms of when we get to the end awards date.
Okay, but obviously you do accept your issue, or one of the main barriers is that members around this committee are not in that place yet regarding where you are and what you're doing as an organisation fully. So maybe that reassurance comes in briefing papers or depending on what that decision is tonight. Because obviously if this committee did make the decision of an SV, then much more detail would have to come here in pretty quick, recommendations that we will make tonight. So, thank you, Paul. Councillor Joy, I'm just going to come to you, then I'll come to Councillor Murray, and then Liam.
Thank you, Chair. As you said, it was the first time it came to us, but it's the first time that anyone from children have also heard this. I was just looking at the top of Appendix 2, regards to assessment of whether or not a proposal for development of the health service or a variation of provision of the health service in Medway is substantial. And when you go back to top of page 35, it says 5, please provide evidence the proposal meets the government's 5 tests for service charge. And it's got 5 things down there, and then on the responses where I think it's actually come from you guys, it says A, strong public and patient engagement, market event held including patient representation, public engagement plans for transformation phase within the first year of the contract. Actually looking at your numbers, you've got 175 people who attended an event, and you've got 287 people that have responded to a survey, including staff. That gives you a total of 0.0001% of the population of Kent and Medway. We did a consultation on red routes, and we got 0.0034%, which is 3 times the amount. Your own data states you reached out to 1.1 million people against Kent and Medway. That would say 2/3 of the population of Kent and Medway had been reached out to, but we've got 14 councillors sitting here, and I'm pretty sure from what I've been hearing, we've got 14 councillors that didn't have a clue about this, and with them sort of figures, that's 2/3 you've reached out to. You'd expect 9 to 10 councillors to have been aware of something like this. You're saying this is not a variation because the first year is transformation. Well, unless something's written into your contract that's saying after the first year, it comes back to committees and they go, nope, this is a variation, you've got to change it. Can you get out of them contracts? And if the answer is no, then the decision needs to be made now, not in a year's time when it all kicks in. Because if after the first year, they're on a 3-year contract with a +2 at the end, which is normally most government contracts, the cost for you to come out of that contract will be detrimental to every resident in Medway because there will be a financial implication. So after 1 year and they go, comes through, so there's some substantial variation, and then you've got to go back to the drawing board. You then go, oh, sorry, we've not realised this, but it's a variation. We've got to start again. All them companies got contracts and going, well, if you want to pull out of this contract, there's penalties in there, because there'll be penalties both ways. So unless there's no penalty stage after year 1, when you're saying that's when we can make a decision on the substantial variations, and there's a get-out clause that says after 1 year, if somebody like us or Kent County Council says there is substantial variation and we've got to go back to the drawing board, and you can literally walk away from it, that decision needs to be made now. And your argument that it's got to be made in a year's time once we go through transformation, we need to know now, is that contract got a get-out clause at 0 cost to Kent and Medway residents after 1 year? Thank you.
Thank you. So the contracts that will be awarded to the providers will absolutely contractually have the requirement to transform. That will be a part of the contract, and the contracts will be written in a way such that if the provider does not do that, and obviously going through the contractual process, then they will be in breach of contract, and we will have the rights to act accordingly. I don't think, to answer your question, that I had in mind that with those providers that they would come back here and come back into the HOSC in Kent after a year and say we are minded to do this. I think we would work in collaboration and jointly to keep this committee abreast of what is being proposed. And if there is a change in service provision that meets that obligation under a substantial variation, absolutely that would come back here. but the contracts that would be awarded would have an express requirement to do that transformation.
I can understand where you're saying that they're required to do transformation, but is a contract going to be a cut at 1 year? So if the variation comes in, and it's a substantial variation in 1 year, because that's what you're saying is that you really haven't, there's no variation till a year's time once transformation kicks in. But if they're contracted for 3 years, there's going to be a financial penalty to Medway residents, and you've not actually answered when this contract that you're going to tender for, is it for a 3-year period as standard, or is there a get-out clause at no cost at 1 year, regardless of whether there's any fault on the provider?
No, the contract is for longer than 3 years, and there isn't an exit without fault on either side.
Thank you, Councillor Joy. David, would you like to come in?
Thank you. Yeah, just want to come back and make some more clarification about one part. So in your response to one of Councillor Wardy's questions, you talked about, when talking about the assessment of need, you talked about using public health data and other data sources. Just want to be clear for members that the normal part of the process would be to create a needs assessment where you bring together lots of different bits of information, and as far as I'm aware, that hasn't taken place. So what you've done is taken different products that have been produced by different groups. So, for example, some of the things that we produced in public health, but there hasn't been an actual needs assessment. Is that correct?
We would base it, sorry, and I couldn't find the language in answering Councillor Wade's case, we would absolutely base it on the GSNA in terms of what that looks like. A lot of that analysis did go into the integrated care system strategy that was approved by, sorry. Apologies, I thought you wanted to come back. So a lot of the data was in there, but we would do more to make sure it was up to date and that it was forecasting as much as retrospective.
Just to be clear on that, Paul, nothing's taken place as yet. Because that's what David's saying, that work hasn't taken place as yet.
No, I would disagree with that. I think there was a lot of work that took place that informed the integrated care strategy that was approved by the 3 bodies, and it was very heavily informed by public health and very valuable for doing so. In answering the specifics of your question, have we done as much as we need to get to that point? No, we have not.
Thank you, David. Leanne.
Thank you, Chair. Just for completeness, Paul, I found the set of papers that I was chairing to. So the terms of reference for the Kent and Medway Children and Young People's Programme Board, April 23, I was chairing to that. You're quite right. It says the board will have oversight of work being undertaken across the ICS. It will be well placed to support shared learnings across Kent and Medway. Then it goes on. The board will be accountable to the ICB. The board is established as a formal board of the ICB. It further goes on outside of individual powers of authority and delegated limits. The board shall not have any collective delegated authority. So I think if we pick that up as part of me looking at the joint commissioning arrangements, and Mike, I think this is going back to September meeting. These are terms of reference. So if these are not reflecting what they should, then they need changing, please.
Thank you, Lan. Any other comments? Councillor Murray, and just ending with you before I can move over to Wayne.
I mean, thank you for the questions and thank you for the answers as well. And I have to confess I feel a bit confused. If what is being looked for is service transformation, then I don't understand why that is being looked for in the context of a re-procurement with new providers. Because if a new provider is being sought and the deal is sealed within 3 months, everything else will have to flow. Everything else we've talked about, everything else that's desirable will have to happen in that first year. So far from that being an attractive period where staff are going to be working with a larger group, it will be a period of huge instability where the existing services won't know whether they're going to be recommissioned or not, where the 4 lots put an entirely different complexion on the way the services are delivered now. And I wonder, in hearing me say that, am I missing something? Is it that you have seen a sort of Shangri-La model of a provider who is capable of being able to deliver children and adult services in a way that is extremely desirable and effective and cost-effective? Or is it that you believe that you can achieve that in a year of transformation? Because, to be honest, I don't think there's any reality in either of those options. Far better to do service transformation, looking at the individual parts of the services in the situation that they are in now, do a proper needs analysis with all of the data and expertise and joint working that is available, and then conclude what transformation is needed. I can't imagine that there will be a provider in place capable of achieving all of these things. And when we've got provision that has been designed around the needs of our children in Medway, I honestly feel that that is that those services are going to be imperiled by this process, not improved by it, Paul and Mike. And I think, there is an opportunity for you to think again about what you mean by service transformation and the difference between that and reprocuring a service, because the person who is awarded, the organisations, whoever they turn out to be, who are awarded the whole weight of trying to transform this service, will have to be an organisation that is capable of understanding everything that's going on now, understanding what is wanted by transformation, and as Councillor Hamadishe was inferring, ending up at the end of the year with something that has safeguarded everything. I think that is going to be extremely difficult to do.
Thank you. I'm struggling to understand some of the timescales that you're describing, the 3 months, because it isn't 3 months. I would agree with you that it is an extraordinarily challenging thing to do, but I wouldn't agree with you that it's an impossibility.
Thank you very much, Councillor Murray. Thank you, Paul. Wayne, before I just close the comments, would you just like to remind members what the SV process is, please, especially for those members, new members, and also members that are around the table from, even though they don't have a vote on the SV, but members that are around the table from CYP.
Yeah, thank you, Chairperson. So in terms of, if I guide members through the covering report, so firstly, obviously we've provided you with some background in terms of where we were last year, and then obviously coming to HASC in September through to January regarding the adults element. And at that point, health colleagues had obviously visited Kent's Health Scrutiny Committee on the same basis on children and adults being the services being reprocured on a Kent geographical basis. And obviously, just to be clear to everybody, that Kent's Health Scrutiny Committee did decide that it wasn't an SV for Kent. So that's just to make everybody clear in here. So obviously the issue of making a decision around substantial variation is a valid one at this stage. So if I go into section 4 of the report regarding the substantial, what we call substantial developments or variations, so I'm referring members now to page 21 of the papers. So in terms of the law, just to be clear, we're talking about the Local Authority Public Health, Health and Wellbeing Boards and Health Scrutiny Regulations 2013. So we talk about obviously proposals under consideration. We kind of then give you some guidance around obviously some of the, what's the word, but in terms of, some of these terms aren't necessarily very precise, so it's a matter for yourselves as the committee to kind of reach that point, and in terms of to assist members, We obviously asked colleagues, health colleagues, to provide that substantial variation questionnaire for us. So we've got that at Appendix 2. So in terms of, again, for members' benefit, we liaise with our legal services colleagues ahead of, obviously, the meeting papers being distributed. In terms of, obviously, the previous SV questionnaire, which had been provided by NHS colleagues, in terms of, obviously, the committee's previous decision to obviously decide it was an SV in relation to adult service, and then what we wanted to do in terms of, obviously, now coming to light around the children element being kind of added into the mix at this point. So health colleagues have provided an updated SV questionnaire which takes account of both the adults element and the children's element. And if I just kind of refer you to the tail end of the SV questionnaire, obviously, again, from the NHS colleagues' perspective, they don't believe it is an SV at this stage. However, there is a kind of an acceptance around obviously what's happened here. So it says, obviously, the ICB recognises that the committee have already determined the procurement of adult community services is a substantial variation. Obviously, the need to present updates to HASC in terms of going forward. So I think for tonight, members, in terms of reaching a decision on SV, you want to take account of, obviously, the discussions this evening, as well as the SV questionnaire itself. And then in terms of the impact of deciding it's an SV again, because we're asking you then effectively to make a new decision covering those adult and children's services. That's really covered in paragraph 4.9 of the report. And it talks really around consultation. So again, I think it may be just helpful for members if I just go through that section in kind of totality. So obviously, if the committee make a decision to decide it's an SV tonight, the proposer of substantial developments or variations must notify the committee the timescales, i.e. our ICB colleagues, which must be published. When consulting on substantial developments or variations, the relevant NHS body must notify the committee of the date by which it requires the committee to provide comments in response to the consultation and the date by which it intends to make a decision as to whether to proceed with the proposal. These dates also must be published. This is so that local patients' communities are aware of the timescales that are being followed, and obviously any changes to the dates must be notified and published. So I'll leave it there for the moment, Chairperson, but happy to take any questions.
Thank you so much, Wayne. I mean, first of all, I thank I thank you, Paul, and Mike. You haven't spoken tonight, but I do thank you, Paul, for answering the questions this evening. As Councillor Murray always said, has already said, it's really helpful you've come here, and obviously you've also come in and apologised to HASC, and we've taken that as a positive approach across a joint responsibility, making sure that hopefully it never happens again. And it's also really good to have CYP around the table. It's something we should look at, I think, in the future, because it's very in that transition part into adulthood. I know it's mentioned on this board many times, on this panel. It's been really helpful having that integration. I think for me, Paul, and to try and sum up for the committee, I think I am going to say again, and I think it won't surprise you, I would have thought lessons have been learnt from the adult community services procurement, because we had quite a horrendous time, and your officers were really, I'm going to say Mark has really worked with us now, but at the beginning it was quite, it was very tetchy between HASC and your officers, and I know since then we're looking at how we learnt lessons from that and how we're working more closely together. That's why this was a surprise, because obviously we had now a relationship regarding that. So I suppose when this comes along and it almost looks similar with that 3-month window again, and I'm going to say, this is just summing up, Paul. You don't have to answer all the questions because I know we're going to, but I'm going to just go on again about that tender amount. It's exactly the same that happened last time. We didn't know the tender amount. The consultation process is unclear whether enough Medway residents have been. I know you're going to provide some consultation data, but by reading your report, there isn't a lot of data in there regarding the amount of detail, including what Councillor Joyce said about us not even knowing about them events, etc. To me, again, it sounds, and I know you will go against, you would disagree, but it does sound like a rushed approach, but you did agree that ideally you can't do it in 3 months, you need longer. But again, I'm reiterating what I said with your last procurement process. It seems like a rushed approach to me. I think the transformation journey is unclear and maybe, hopefully not clear to you and your board, not totally clear to HAS members at this moment in time. So that, we're talking about children here and we're talking about vulnerable residents that when you're going over a transition of this service in particular, we need to make sure that it's happening right. We need to be assured that it's happening correctly. So again, we had that concern about the lack of where there's going to be investment, if there's going to be cuts. So for me, and the members around the table here to agree or disagree, I do feel that, I would be proposing a SV, a substantial variation. I think that was recognised anyway, partly within the questionnaire. I would hope it doesn't come to too much of a surprise to you, because I feel that, in fairness to this committee, we need more detail on this process. In saying that, first of all, I suppose the first thing I need to do, I'm proposing the SV, and I'm looking for a seconder on that SV.
Chairman, I come in. Sorry, I know you aren't asking for me to come in at every point. Can I just explain the views of the ICB just before you make
for the SV?
For the SV, solely on the issue of the SV.
Okay.
I absolutely recognise, and I have apologised, that the issue of children's services should have been before this committee before. But the issue for me is, what are we looking to achieve? And I think it's a we, not you, because it will have an impact. What is it that we're looking to achieve by determining that children's services is the subject of an SV? I absolutely, and you've heard me on a number of occasions, have committed to provide you with further information. I am struggling, and I apologise for repeating myself. I don't believe that this process is doable in 3 months, because we've already had 3 months. It is absolutely our failure that did not come before this committee before tonight, our fault. But I'm really struggling to understand what the benefit in terms of the delivery of service provision will be out of the determination to call an SV. I'm not for a moment challenging you. Absolutely have the ability to do that. That is a decision for this committee, and you must do what you feel is the right thing for the people that we serve. But in a world where we will provide you with the information, provide you with the extra information, go through the education and training that Leanne proposed earlier in terms of how a well-working HOSC would be fed by ourselves as the NHS. And I am just struggling to understand what the benefit of it would be.
I think, Paul, and I appreciate you can come back to me, and I know you, and I do respect, you do know it's a council decision when someone seconded it. For me, what I would say as chair, and I've got a fantastic committee here, but what I would say as chair is that, and I don't want to sound patronising because it's going to sound terrible to you, Paul, but I'm going to say it. I would go back and look at what happened a year ago here. We had the same sort of discussion here saying if you do an SV, you're going to delay things, it's not going to work, it's not going to help that adult procurement services, it's going to delay everything, you don't know what you're going to be doing. And I know you haven't said that, Paul, but that was the sort of reaction we had at that time. And actually, from an officer, from one of your officers that was here.
Sorry, Chair, but
I don't want to name the officer or go into that.
And I'm not asking you to, but I just want to be really clear, that is not my reaction tonight.
And that's what
and I have not said that, and I would not do that. Paul, so I apologise for that disrespectful approach.
Paul, I have said that. I have said that because I would soon tell you if you did, honestly. You haven't been like the way we were treated last year. I don't want to revisit that, because what I'm trying to reiterate is when we slowed it down, when we asked for the information, what happened in the long term was the relationship improved, the relationship between your officers with that community procurement process, the information we received improved tremendously. I think Leanne will agree, and others. We ended up getting regular reports, and we built that rapport instead of being enemies round the table. I don't want us going backwards, right? And I feel the frustrations of members where the detail isn't there and the detail isn't clear. And, the SV will help that process moving forward with us, making sure we get everything we asked for. Maybe you're slowing down a little bit because, You know, we need that information. The questions that have been asked tonight about the community engagement, etc., need to be answered or improved or actually set up to make sure there's some more engagement. That's just one element. But I do feel that the aim of the SV, and I've always said this to everyone we've done when I've done an SV, isn't to break relationships down, it's to improve the relationship and actually hopefully give the external bodies some idea that HASC, you have to work with HASC. You know, and I know you've agreed that tonight with Leanne, etc., but HASC has to be worked with because we are residents in this community. Many have children, many know people with children, and we want what's best for our community. That's the reason we make the decisions, not just to cause you problems going back to your board tomorrow. It's about making sure what's agreed is correct. We've seen the detail, and then we actually go on that journey with you, because we need to be on that journey with you. We don't want to be going in an opposite direction and keep calling you back and haranguing you because it's wrong. That's the way I see it as a positive move forward. I try and tell external bodies, it may not feel like that, but to me, that's what it is, because you have us working with you to that final goal of hopefully having a great service in place rather than that we're assured of. It's still your vision, but we need to be assured of that final goal for you. I mean, that's where I am, Paul, at that. I've got Councillor Wildey seconding me, is that correct?
Yep.
Okay. So I've got a proposal, Mark, I'm going to come to you in a moment. Councillor Wildey?
Can I just add, to me, the big advantage of an SV is you have to look more closely at what you're doing, work more with your commissioners. Yes, you've got to report, not got to, that sounds wrong, but there will be reports to this committee, so there will be more thought going into the process, and hopefully benefits will come out of that. And even if you end up doing exactly the same thing, we will have been convinced, as well as the public, that you have been through the right process and you have looked at it properly and sensibly, because, as I said before, 2 listening events, 8 pages, which is all publicly that you've provided, just is not a good look. So that's why I think it should be an SV and will be an advantage.
Thank you, Councillor. No, that's okay. Thank you. So I've got, obviously the Vice Chair will sum this up, but I've got a seconder for the SV. Is that agreed? For a substantial variation tonight. Is that agreed by members? Agreed? Okay, thank you. Mark, if you can try and sum that up in my own, you don't have to use all the words I've used, but thank you.
I move that the committee note the report from the Integrated Care Board as set out in Appendix 1 to this report, decide that the updated proposals do constitute a substantial variation or development in the provision of health services in Medway, request the ICB to publish the timescale, specifically the date by which it requires the committee to provide its comments in response to the outcome of consultation, and the date by which it intends to make a decision as set out in paragraph 4.9 of the report, and also a briefing paper to be provided for any questions where answers weren't able to be provided tonight.
Thank you, Vice Chair. Is that seconded? Seconded. Is that agreed, members? Agreed, thank you. Paul, I know from the last one we did, I think Wayne or you'll be in touch anyway about our timescales and that to make sure. But again, thank you for everyone who's attended, and thank you for your candour for being for taking all the questions this evening, and to Councillor Joy and Councillor Murray as well. Thank you very much for your attendance. Yeah, that's the end of the meeting, guys. Thank you very much. Thank you.